Between May 2020 and April 2021, there were approximately 100,000 opioid overdose deaths across the United States. In 2011, the CDC declared overdoses from prescription painkillers an epidemic, and in 2017, the United States Department of Health and Human Services declared opioids a public emergency. The main points that I will be discussing about the opioid epidemic are 1. How opioid abuse became an epidemic, 2. The common opioids and their timelines of popularity, 3. How opioids affects those that use them, both long and short term, and 4. The popular treatments and treatment options for those that abuse opioids. Many trace the opioid epidemic back to the 1980s and the 1990s, when pain was recognized as the fifth vital sign that needed to be acknowledged and needed to be treated, such as blood pressure and vital signs. Pharmaceutical companies at the time had promised that the prescription painkillers would not be addictive and they would have little to no side effects for the patients that use them. Because of this, many healthcare providers began to prescribe a number of patients a lot of pain relievers if they were in pain, and a lot of the times there was not much to check if they were in pain except for their word. In October of 2021, the Department of Health and Human Services published that it was found that prescription painkillers not only were addictive, but they were highly addictive. Common opioids that are abused include prescription medications that are legal and also illegal opioids such as fentanyl and heroin. One of the biggest legal painkillers was Oxycontin, which came out in about the 1990s. So Oxycontin was once called the focal point of opioid abuse issues by the Food and Drug Administration. According to the State Health Access Data Center, overdose deaths from heroin started in 2011, reached an all-time high in 2015, and around that same time, synthetic opioids began to double in deaths in 2013. Opioids affect those that use them both short and long term. Short term, the effects include the high that users receive from taking the opioids, which includes a relaxing feeling, but comes along with side effects such as nausea, drowsiness, etc. Some long-term effects of opioids include Medline Plus published in August of 2020 that opioids change the chemistry of the brain of those that use them, which leads to tolerance. And tolerance means that the user must use more and more to achieve the same effect or the same high that they received from taking less in the past. Tolerance can then lead to dependence. Dependence is when the user starts to get withdrawals if they don't take the drug or the opioid. Withdrawal symptoms include symptoms such as anxiety, nausea, muscle cramping, restless legs, hot and cold chills, teary eyes, and more. Symptoms vary based on length of drug use, amount of drug use, and method of drug use, which can be injecting, it can be snorting, it can be smoking, and many others. Popular treatments for opioid users. The first treatment that opioid users usually go for is detox. Detox is a facility that users go to be assisted in stopping their drug of choice, which in this case is opioids. Detox usually uses medication-assisted treatment based on the severity of symptoms and that person's choice in which drug that they would like to use. The two drugs or the two medications that are usually used to help someone get off of opioids include methadone and Suboxone. Methadone and Suboxone can also be used in an outpatient setting, and it can be prescribed where someone is able to go pick up their medication every day, or you can also get a prescription of Suboxone for a varied amount of time, depending on the doctor and how much you use, and things such as that. The opioid epidemic has been going on for decades now, and there have been more and more policies and things set in place to try to help the opioid epidemic. And instead of punishing the users, we're getting to a point where we are now trying to help them, and we are now acknowledging addiction as a disease, and hopefully getting to the root of the problem with this, and hopefully we're going to keep going and fix this.